The new coronavirus originated in 2019 in Hubei province in China. It is similar to other coronaviruses such as those that caused SARS in 2003 and MERS in 2012. These viruses originate in animals and then transform themselves. They are then able to infect humans and to transfer from person to person. The degree to which they are contagious varies. For the current 2019 virus, it appears that direct contact with an infected person, or possibly being within a 2-meter area of an infected person for a reasonable period of time, may increase the risk of the infection transmitting. So travelers should keep this in mind and make travel decisions wisely and not irrationally. Most cases of coronavirus will have mild symptoms and you will recover. Severe and sometimes fatal cases of flu-like illnesses and infections of the lung are possible, but these appear to be mainly in cases where the infected person was elderly, had a significantly weakened immune system, or had heart or lung disease prior to the illness. So again, travelers should make wise and rational decisions about their decision to travel. For people in good health, the risk is very low. Except for China, travelers to the majority of destinations in the world, the risk is very low, and travelers should not abandon their travel plans at this time. During the Hajj pilgrimage and other mass gatherings such as the Olympics, there are many people in close proximity to each other for prolonged periods of time. The risk of infections that are spread by direct contact and through the air by people coughing and sneezing will potentially rise. During such gatherings, the risk of lung infections such as pneumonia and pertussis is high, the risk for influenza is high, and so is the risk for diarrheal illnesses. So travelers should discuss vaccination for these illnesses with their travel doctor. The risk for coronaviruses in the past has been low, but appropriate precautions must be taken, such as frequent hand washing, especially before meals. If water is not available, use an alcohol-based hand sanitizer. Please remember to turn off taps after hand washing with a paper towel or your elbows, and not your hands, as these will be contaminated again from the faucets. Of course, if you are serving yourself from a buffet, then wash your hands before you start eating, or use a pair of disposable gloves to serve your food so that the serving spoons and tongs do not contaminate your hands prior to eating. The use of face masks will be helpful. These should fit tightly around the face. Consider an N95 mask. It may be more strenuous to wear, but it will give you the best level of protection. Avoid shaking hands and kissing each other on the face, as is the custom in many parts of the world. Travel overseas promises great adventure and experiences, but it always has risks. However, these risks can be well managed by visiting a doctor specialized in travel medicine. So please, go ahead and make your travel plans, but consult with your local doctor with expertise in travel medicine prior to travel. Travel medical insurance and travel cancellation insurance are always wise to purchase as you make the bookings for any trip.